for our podcast talking about mental health and self-care for caregivers. Today, because of it being a special month, the month of September, where we recognize assisted livings all across the country. So I thought to bring in an administrator of an assisted living facility here in the city of Chattanooga, where I actually live. I want to welcome Miss Cherry Hudgens. How you doing, Cherry?
I'm doing fine. How are you doing?
Fine. Thank you so much for saying that you would come and be a part of the podcast today. You know, this is a special time for us.
It is.
Every year we get an opportunity to celebrate because of President Clinton. He came up with the weekly notarization for assisted livings. But tell me something about you, Cherry. You know, you are an administrator for an assisted living facility. How long have you done this? And tell us something about why you chose to do this type of, business and your role, your everyday role as an administrator.
Well, of course, my name is Cherry Hudgens, and a little bit about me. I have been the administrator at Rosa Sharon a little over 20 years.
20 years.
Started off as the administrator assistant, and then of course I became the administrator. So it's a little bit over 21 years that I've been there. And my background is what I got my degree in is business administration. So I didn't really pick this job. I think the job really picked me.
Did it pick you?
I think it really picked me, and I've quite enjoyed it. I've met a lot of people over my course of years, and the different things that I've went through personally with myself, having certain people there that can relate with different things that was going on in my life, and they can tell me stories of things they may have encountered during their era. So, you know, great camaraderie, communications with all the different people that have come our way, because we've taken care of quite a bit of people over the course of 21 years. But pretty much what I do on a day-to-day basis, I'm the overseer of all of our policies and procedures. You know, things change. Of course, you know, with COVID, we had to adopt a lot of different.
I bet that was a difficult
Very
time.
very difficult. From the shutdowns, getting people to understand. You're dealing with people with dementia, making sure they understand what's going on. You know, they're wanting to get out. You know, we're wanting to get out, and
I bet you were dealing with families.
Dealing with families, not understanding that they can't come to the facility, and if they do, the protocol on how we can do things. So, you know, everything was a change.
It was a change all across the country.
Exactly. And to this day, we're still going through different changes of what the state is requiring us to do. You know, from opening back up to possibly getting ready to go back into.
Wow.
So, you know, all those different things takes a toll. So, of course, like I was saying, my day-to-day is policies and procedures, making sure my staff is following the policies and procedures, making sure we are doing the things that the state requires of us to do, and to service our residents.
Well, it sounds like you've done a fantastic job. If you've been there that length of time,
Yes.
You've been there a long time.
I've been there a long time. So, you know, and the different changes, you know, over the course of the years, from when we first initially started, we was not an assisted living, we was home for the aged.
Wow.
And then we was on the front end of the Choices program. A lot of people may not understand or know exactly what that is, and each state is different. But ours here is called Choices, and that's where we deal with the Medicaid dollars with TennCare. And it taps in and it helps people, you know, who gets SSI or have some type of medical conditions that's going on where they can't stay in the home. They're not quite ready for the nursing home, or choose not to want to go to the nursing home.
Right.
They want to stay in their community and they want to receive services. So that's where we come in at, and we are a provider for that particular program.
Well, I wonder what lines you up to be in your position. What type of education do you have to have in order to do your administrative work? Can you just be someone without any type of college degree, or do you have a college degree?
I do have a college degree. I went to Tennessee State University, and like I stated earlier, I do have my degree in business administration. Now, according to the state says no, you do not have to have a degree. But with the magnitude of what this business is and understanding the type of work that you're doing, I would suggest that an administrator should have a background of, experience in this particular position.
Well,
Because it's a lot.
do the state require you to have an administration degree or a license?
Well, yes, you do have to be licensed. So what happens is you'll complete an application, you'll go through the rigorous application process that they have in place. And if you meet all of their guidelines of what they require for you to have, then you can receive your administrative license. And of course, you have to take classes. I have to take classes 12 hours per year. So that my license is renewed every 2. So that's 24 hours of CEUs that I have to have in order to keep my license up to date. And I have to pay a fee.
Well,
Yeah.
well, that's great. I'm sure that each state has their different requirements, but you're just mainly talking about the state where you live,
Right, which
in the
is
state of Tennessee.
Correct.
Yeah, but tell me the difference. A lot of times what I find people to do is to confuse an assisted living facility with a nursing home. Can you tell me the difference? What makes it different?
It's real simple. We're not skilled care. Skilled care is if I'm having to do total care for an individual, feed them, turn them in their bed because they can't get up. I'm having to administer their medications. Anything where I'm having to do total of something and they can't do it, that is considered skilled care. We are not skilled care. We are an assisted living. And assisted living kind of speaks for itself. We assist them with their activities of daily living. So you may hear people say ADLs. ADLs
Yeah, what is that?
Activities of daily living. So we all have ADLs that we have to meet, right? So you have to be able to feed yourself. You have to be able to clothe yourself, clean your room, answer phones, all those different things that are considered part of your life, activities within your life. We look at those things. So a person must be able to still kind of do that. They just need assistance. They can't cook anymore, but I can feed myself.
Right.
I may not eat a full meal. I may, I just eat a little sandwich or something. We're there to make sure they're getting a full meal. We're making sure they're getting their medications. I can't remember to take my meds, but I can take them if somebody remind me. I can put it in my mouth and I can swallow. I'm assisting you. I can walk, but I may need a little help every now and again, just kind of getting out this chair.
Or you might use a walker or cane.
Or you may use a walker or cane. So that's kind of how the difference. That's when you can tell. So a lot of people call our facility and they'll say, y'all a nursing home? And I'm like, no, we're not a nursing home. And of course I have to go through the detailing of who we are and what we are.
And what I think is a main qualification that will determine that a person should not be in an assisted living facility. A safety code, didn't it?
Well, you have something called a PAE. That's a pre-assessment evaluation that they will conduct. And so if you meet certain requirements and you're over the number that requires you to be in an assisted living, and it deems that, hey, this person is more of a nursing home, then they'll definitely make sure that that's where you're going. They're not going to put you where you shouldn't be. And an assisted living should not accept you,
They should.
knowing that you have all of these different qualities that you're needing more assistance in. So I wouldn't even recommend,
Someone
going to a
that's
facility.
bedridden.
Right, they should not be in assisted living.
No.
Yes, should not.
For some places you go into and you will see those type of clients still remaining in an assisted living facility. I know one of the qualifications, isn't it, that you can be in the hospice program and live in an assisted living facility. How did that go?
Well, there's a little catch to that. A person can't come to my facility in hospice, but if they live in my facility and this is the next stage, and the family and or that resident deems, hey, I want to stay here. I love it here. I love the people. I know them. They know me. I wish to be here. Then hospice can start that way. but they cannot come into my facility already in part of hospice.
Because I guess an assisted living facility is supposed to be like your home.
Correct.
So you're just moving from one level
Mhm.
to the next, and if someone can't take care of you, then it's time to go
Right.
to a
And
nursing
we've
home.
had situations where a person was on hospital. We've had a few of them. We had one gentleman, I think he had 9 lives. You know, we put him on hospice, I know, at least 3 times. And each time, you know, when people say hospice, of course we know that means end of life. But it doesn't necessarily mean it's getting ready to happen
Right.
tomorrow. We've had some, like I just stated, this particular gentleman, he went on hospice, I know, at least 3 times. And out of those 3, he was able to come off of hospice and start seeing our doctors again and
Wow.
so forth, up walking. You know, we was at one time we was calling the family in, you know, and so things miraculously changed, and he snapped out of whatever he was in, and he got to doing much better. So it doesn't necessarily mean, but sometimes that people need that next level. You know, and I've had some where they was on hospice and we just couldn't care for them anymore. You know, the level that they were needing and how quickly they were deteriorating. It wasn't good for them to stay. So
Right.
we went on ahead and we positioned them in another facility.
Right.
So that will happen.
Wow. You know, I see assisted living as the next stepping ground from someone that shouldn't be left at home alone by themselves anymore, but maybe just not ready for the nursing home.
Right.
Would you say that?
I would.
Okay. So why would you say that?
Well, I say that pretty much what we've been talking about. You know, maybe family members are not home to be able to monitor or don't have the family.
Right.
You know, a lot of people here, our little people, they don't really have a lot, you know. So that's where we come in at. We become their family. And so if you no longer can meet those needs staying at home, and you don't have someone that can come into the home to take care of you, or you know, rent is going up, and
Right.
so a lot of them probably can't afford to stay in an independent setting anymore, and still needing all these different things that they may have had to pay, you know, pay a neighbor to take them to the store, or somebody to come over because they can't afford that. So this is an opportunity for them to come into our facility.
Well, let me ask you something. Do insurance pay for assisted living, or how did that go?
Well, yes, they do. So as I mentioned, there's the Choices program.
But don't you have to be qualified?
You have to be qualified for that. So the Choices program, if you meet Medicaid qualifications,
Oh, you got to be on
you
Medicaid.
have to be on Medicaid.
Oh, wow.
Okay, so in order to tap into those dollars. Now, you also have other things. If you have long-term care insurance, which a lot of people don't, but that's another outlet that you can tap in funds. If you're a veteran, you can tap in funds there to assist you with living in our facility.
What about their spouses?
Same thing. It all depends on, you know, if the husband's still alive and all that. So it's a lot of dynamics to that. But if you do have a living spouse, so let's hypothetically say that the husband passed away, wife is still here, we can tap into those funds too. May not be as much as what the husband would have received, but those are funds that we can tap into.
Wow. So it's a lot of things out there, but we just need to know about it. And a lot of our MCOs and our insurances that people are qualifying to be a part of with, I think next month is the month of October, is the month that they can change
Right.
their insurances.
Well, actually, yes, that's true. But what we have discovered, you can kind of change whenever.
Oh,
So
wow.
we didn't know that. My social worker and I came across this information. I want to say about a week or so ago. We was having some issues with one of our residents with their particular insurance, and we were notified that you can change if you like. And I was shocked. I said, "Oh, okay. Well, we want to change." So she can get the services that she needed. So, and it worked out. The insurance was changed, and we're in motion.
you know, a lot of times, a lot of things are held back
Mhm.
from people, and we don't know about those resources or those different changes that take a place for us to be able to help residents to get the proper quality of care.
Right. Right.
You know, and I know that some assisted living facilities are very costly.
Absolutely, they are. You know, our fee is 2,500. We've been that amount. I know for at least 5 years, if not longer.
Wow.
And we do accept Section 8 vouchers through the HUD program, which is also part of Chattanooga Housing here in Chattanooga. So we do accept those, and we control our own vouchers. So that helps towards that person's rent. And if they live in our facility for over a year, and let's hypothetically say that person begin, you know, they get better, and they decide they want to get their own apartment that accepts Section 8, that voucher can follow them. Not ours, we'll keep ours, but they can get a voucher that will follow them to that next place. That's a good thing for those that are wanting. They don't have to be on that waiting list. They just do a relocation, and they'll
Wow.
start the process. So we are able to at least assist people in that. And then, of course, the Choices Program, which is insurance, will pay us the other amount. And normally, a person with SSI, that now we're looking at probably maybe $50 or so that they're lacking of needing to pay us. So that's kind of how that works.
Well, they better be glad that they got a program like yours, because I heard a lot of assisted living facilities, they can run in between $5,000 to $6,000 a month.
That is correct.
Wow.
That is correct. And on top of that, in Chattanooga, there are only two choices providers when it comes to assisted living.
Wow.
So, you know, people need to understand that, because when things happen, let's hypothetically say I become full and that other place becomes full, but mom is needing choices. Maybe in South Pittsburgh, they may go to Nashville, they may go, or just be on a waiting list. So, you know, those are things that you really have to consider when you're tapping into these dollars and you're trying to find services. So you may find yourself having to do in-home care.
Well, tell me, what type of services can my parents expect to receive when living in an assisted living?
Well, going back to what I stated to you earlier, activities of daily living, we're going to assist you with that. So, baths. My staff is going to assist a resident with at least 3 baths out of the week, okay? Now, if they can get up and they can bathe every day, feel free. But what we're going to come in at is we're going to make sure we assist them with at least 3. They're going to get their 3 meals and their 2 snacks. We got a person that does activities. We do activities will consist of field trips and games. We have a nurse practitioner that comes in and sees our residents. We now finally, I used to have one years ago, and we end up, he retired, and so we end up having to send our residents out for foot care, podiatrist. So now we actually have one that's getting ready to come in-house. So I'm so thankful for that. So we have a podiatrist that will come over, and if they see anything going on with that person's foot, they can then outsource and get them taken care of. We just recently had a lab company that we just signed up with, so that we don't have to go to like different lab companies outside of Rosa Sharon. They will actually come to our facility and draw that person's labs for us. A lot of great things that they are able to do. They're even able to take their medications and see if anything is interacting with other meds. And I really like that. So
and
that's
we assist them with their medications.
Right.
That's one of the top things
Right.
that's different that you get in assisted living. And it's under lock and key, so they don't overdose themselves.
Right. Well, meds are always kept behind a locked door. Residents do not have access to their medications. It's only when we get ready to assist them with their meds, that's where that comes in at. We do have nurses. We have 2 registered nurses. We have a pharmacy that we've been dealing with for pretty much the little time I've been there, to a little over 21 years that we've been dealing with this particular pharmacy. We have a company that comes in and does their x-rays, so if they need anything like that done, we have that coming in. So we have an array of services that we have in place. for our residents, and so they don't have to really just go out. Family, and it helps family members too, because if they don't have anybody, then we know something is in place to help them.
You would say that an assisted living facility, do it cut down on emergency room visits or hospital visits?
It does. It does. You know, because you do have nurses in place, and we kind of know what's going on, and we can stop different things happening before having to send them off to the emergency room. You know, we panic over all kind of little things, but you know, us, we be like, I wait to go to the doctor, you know, because I'm not going to the emergency room because that bill go cost X, Y, and Z. So that's kind of how we look at it. You know, if it's something that is controllable, we know that this is not a major issue, then we'll keep them at the facility and they'll see the doctor. If it's something that's deemed, hey, they complain of chest pains, that, you know, different things like that, we definitely are sending them on. But yes, it definitely cuts down on emergency room visits, because a lot of people treat an emergency room like it's a doctor's office, and it's not.
I noticed that, and especially during COVID, that we tried to discourage that because of the spread of germs and just trying to get people to social distance. And we need to continue to try to do that.
Right.
I mean, you know, do you all have any special things that you all do for any of your residents that come out to the assisted living since COVID?
What do you mean?
I mean, like taking temperatures when people enter, and, you know, have anything lined up like that?
As I mentioned, you know, we did have to set protocols and things of that nature with COVID. And so, yes, those were some of the things we had to do. Temperatures, masks. You know, I had a few people that had COVID. It was certain protocols that we had to do with that, keeping them isolated, being able to have to eat in their rooms, how we went into the rooms. We had to put on our PPE gear as well before we went into the rooms, and how we discard them. It was an array of different things that we had to do.
It was a change of life.
It really was. It really was. Yeah, changes have been made. People are a little bit more lenient now. It's trying to get them back to understanding, hey, we may have to put our mask back on. We may have to, you know, go back to social distancing. Because we even changed our lunch and our times that we would eat. Only had small groups, so we had three groups, group 1, 2, and 3, and they each had times they was able to go into the dining room to have their meal for the day.
Well, it seemed like you really thought this out and thought out ways for safety for our residents at your assisted living facility. And, you know, just being a person that really cares, because you all were the people on the front line. You couldn't go home like America shut down. You couldn't shut your assisted living facility down. You had to stay on the trail doing what a lot of people had to do that worked in hospitals, nursing homes, assisted living facilities, places like adult day centers. We shut those down for a while, but you could not shut down a 24/7 facility. So how did you feel about that, having to go home around your children at that time during COVID?
It was definitely scary. I would say that it was definitely scary. I would come home and I would take off the clothes that I had on that day. I was doing the elderberries. I was doing the peelings, the orange peelings and the lemon peelings, and putting them inside of the boiling water, and an array of things. Anything they said you need to do, I think I did it. We had all types of hand sanitizer in the house, you know. So, and then of course, you know, my son at that time, both of them, I had 2 kids in the home at that particular time, they were having to do stuff from home, their work from home.
Yes.
So, you know, and I would have to leave and I would have to go to work and do things there. But like I said, it was just, it was a different world. I mean, I had staff to get COVID as well. That staff had to take care of the people that had COVID in our assisted living. That's how the state required, because we needed people who was going to take care of them. Fortunate that the people that had COVID that was staff, they were not sick, so that made it better. They didn't get sick at all. And to be honest, none of my residents really were sick at all either. They still ate. They said
They
they
weren't
wasn't
gonna
gonna taste
forget
good,
about that food.
but they still ate. They were still getting up. You know, they would go to the restroom. I mean, we didn't have the issues that we saw on TV. Now, don't get me wrong, it was issues, but it wasn't as bad as. Now in my in-home care, that was completely different. They didn't have anybody there. We walked into some homes that we found some of our clients deceased. You know, and those are the challenges of this job. These are things that's going to happen with life. This is what life is. And so I think that took a toll on a lot of us during that era, that time frame of not knowing.
Or wouldn't you say that assisted living is a much needed program for our elderly and disabled and persons with disabilities to be able to have as an in-between stop from home to the nursing home?
Absolutely, but affordable.
Affordable.
There are a lot of our people here that just flat out can't afford an assisted living. All the things that we do, and to know that your income is just $941, because that's what an SSI person would receive, $941. They couldn't afford. They would have to be on the Choices program or something of that nature. So things need to be in place for them, and families need to just get educated on what they need to do.
Well, you know, I think families need to start looking at long-term care issues at an early age, getting long-term care insurance where they can actually help with some payment for an assisted living if they need it, and don't have to strongly
Well, Miss Kelly, that
depend.
sounds lovely.
I know it
Because
does.
we have a lot of people that doesn't even have burial insurance, life insurance. So if they are not doing the life insurance, I know they're not going to do the long-term care insurance, and that's the unfortunate part. Yes, that sounds ideal, but is it realistic? What we're living in today. I mean, still today we have people that do not get life insurance.
Well, you look at how many, I guess it's how many rich people it is in America, as well as say if you're in the middle, you get billed for everything. But if you get poor, you know, you can get in a low income program. But those people stuck in the middle, I see it's being hurting for them.
Absolutely, because when it's time, you know, if mom has saved up and purchased that home, and in order for her to receive services, she would have to let go of that home, sell it. Then we have to do something called a spin down, and when we're doing a spin down, we have to get it under $2,000. So all of that, the dynamics of what we build for in order to receive something as a middle class, you're correct. It's we're not in a good place, honestly, because I look at myself. Will I be able to afford, by the time I'm at that age, can I afford an assisted living? No.
It would probably be $20,000.
Exactly. So I'm hoping my son part of the NFL. So, you know, I'm looking. You know, those are things you have to take in consideration. Here it is now. I'm hoping to have a house paid for, but when I get older, how long can I stay in that home? Or will I have to sell my house and then I'm living in a small apartment type deal, you know,
Or
downside.
back at home with your children.
Or back at home with my kids. So those are just things that we have to kind of, you know, we have to talk about. I'm thankful because my son told me I'm coming with him. So
Wow.
I'm going. He say, let's go, I'm gone.
Well, I ain't mad at you, Mama. Well, another thing is, you know, I appreciate you sitting down through National Assisted Living Week, because people need that in-between piece in their lives.
They do.
When they have no family members, no relatives that can take care of them, and they really don't want to go in a nursing home. Because when you ask them the question, 99% of the people say, I wanna stay at home.
They do.
And so if we can provide some stay-at-home time, that's great. We even got a little smaller, what they call assisted living homes now, that consist of 4 people living together. So it's a lot of things that we have changed to help people to be able to live together. And I wanna thank you for being an administrator that stuck in there for all these years. How many years you say?
Over 21.
A little over 21 years, ever since you got out of Tennessee State, to take care of those who once took care of you. So I appreciate everything you've done over these last 21 years. And thank you so much for being my guest today and was willing to come on.
You're welcome. I really enjoyed this and looking for many more years to come.
Yes.